Hi everyone, welcome to another video. For many people with long COVID, cognitive challenges like brain fog are among the most disruptive symptoms. This can feel like a constant mental haze, making it difficult to focus, remember things, or process information. While traditional strategies like rest and pacing help, new treatments are emerging that offer hope for those struggling with these symptoms. Brain fog in long COVID is thought to result from a combination of factors, including lingering inflammation, disrupted blood flow to the brain, and immune system dysfunction. These factors can create an environment where the brain struggles to function at full capacity. One of the most talked about emerging treatments for long COVID is apheresis. This technique involves filtering the blood to remove specific components, such as inflammatory markers, microclots, or other substances that may be contributing to long COVID symptoms. Here's how it works. During apheresis, blood is drawn from the patient, processed through a specialized machine, and then returned to the body. The goal is to clear potential triggers of inflammation or impaired blood flow, which may be linked to brain fog and other symptoms. While apheresis is still considered experimental for long COVID, early reports suggest it could help improve cognitive symptoms by addressing underlying blood and vascular issues. In addition to apheresis, several other cutting-edge treatments are being explored for long COVID brain fog. Hyperbaric oxygen therapy, HBOT. Patients receive oxygen in a pressurized chamber, which increases oxygen delivery to tissues and may reduce inflammation and improve brain function. Intravenous immunoglobulin, IVIG. IVIG helps regulate the immune system and may address inflammation that contributes to cognitive impairments. Low-dose naltrexone, LDN. This therapy has shown promise in reducing neuroinflammation and improving brain clarity for those with long COVID. Anticoagulants and antiplatelet therapies. These treatments aim to address microclots, which some studies suggest could impair blood flow and oxygen delivery to the brain. What's becoming increasingly clear is that there's no one-size-fits-all solution for long COVID brain fog. Treatments like apheresis and HBOT may work well for some, while others might benefit from immune-modulating therapies or traditional approaches like cognitive rehabilitation. Personalized care, informed by a patient's unique symptoms and medical history, is critical. While these treatments are exciting, it's important to note that many of them are still in experimental stages or not widely available. Patients should consult with their healthcare providers to weigh the potential risks and benefits. Additionally, clinical trials are ongoing, and more data is needed to determine how effective these treatments are across larger groups of people. Alongside these new treatments, lifestyle changes remain a cornerstone of managing brain fog. Pacing activities, improving sleep quality, and practicing stress-reducing techniques like mindfulness can support recovery while pursuing advanced therapies. The growing focus on long COVID in research and healthcare is paving the way for innovative solutions. Treatments like apheresis, hyperbaric oxygen therapy, and immune-modulating approaches represent a new era of hope for those living with persistent cognitive symptoms. If you're struggling with brain fog due to long COVID, explore these emerging options with your healthcare provider. Together, we can navigate these challenges and look toward recovery with hope.